or if there's less burden on the caregiver. The caregiver, by the way, you know, I don't know if anybody knows anybody with Alzheimer's or takes care of anybody with Alzheimer's disease. It's extremely difficult. It's not easy to do. It wears on you 24/7. You've got to be awake, alert, you know, knowing where this person is all the time so they don't wander out in the street. It's a difficult thing to do. If you can ease the burden on the caregiver and give them a few more years before things progress to a more severe state, that's also valuable, I think. So that's how those medicines work. Now, let's talk. I guess we can talk. But first of all, any questions about any of that? I kind of covered a lot. Yeah, go ahead.
The experience I've had with people with Alzheimer's is they don't know it, and they won't admit it.
Correct.
And so how do you what do you do in that case? If somebody's getting to the point they can't take care of themselves, they don't recognize the issue, it becomes pretty tough.
Absolutely right. And the questioner, let me repeat for everyone, the question and sort of comment is that it seems that folks that have Alzheimer's disease don't realize they have it. And then it's difficult to, I'm assuming you're asking, it's difficult to get them motivated to, you know, to stay on treatment or to do different things.
Just to even understand that maybe they need to make a change.
Living arrangement?
Right.
Okay, yes. Very common, yeah. It happens in my office over and over again. And what happens is and I'm guilty of the same thing. I try to explain over and over again to the person who has Alzheimer's disease, you have this disease and it's starting to get to the point where you can't live alone anymore. You're going to either have to have somebody come in with you 24 hours a day, or if you can afford it, or go to an assisted living or nursing home. Of course, patients hate the word nursing home, and that is terrible. And I can see that. I mean, you lose your independence, and the problem is with this illness, it affects your brain, and your brain is what all of our brains are what kind of allow us to know. It gives us insight, It tells us that that we're forgetting something, or that we can't, that we're having depression or whatever, Unfortunately, if it goes awry, if there's some problem in the brain, you sometimes lose insight. So it's extremely common. I'll tell you, folks don't know that they have it, and they argue that they don't have it. And they get kind of sometimes very upset with the family and the physicians who say you have it, That's extremely common. And the best you can do is try to explain it in a non-threatening way and work with the person. But sometimes it comes down to it, it's a safety issue, and the person has to get out of the house, or they have to have somebody come in because they're wandering out on the street at night on a busy highway, or it's 20 below zero outside and they're wandering out in their slippers and nightgown. And then they get lost and they can't figure out how to get back in the house. They could die from that. So you have to intervene. You have to do something. And the hardest part for families is to do that, is to say to Mom, I'm sorry. But what happens is role reversal. It's a complete role reversal. I mean, you as the child, as the adult child of somebody who has Alzheimer's disease, sometimes that child has to be almost like the parent, and you have to be their brain for them. So somebody has to take over paying bills, somebody has to take over making decisions about when they take a bath, when they toilet, things like that. And that's why it's so hard to be a caregiver. Think about that. That's tough. Because not only do you have to constantly keep those things in mind, but then you have to deal with the person who doesn't think they need any of that. But if you just let them go, then they lose their bowel and bladder, or they wander out the street again, or don't take their medicines, or things that can be dangerous. So it's a challenging, that's a tough one. It's a great question, but I don't have an easy answer other than for family members, sometimes you kind of have to stiffen up a little bit and just do what you know is right. It's hard though when it's your mother. You've always looked up to your mother, and now all of a sudden she's dependent on you. That's a big challenge. It's tough. But it's a good question. Other questions? Yeah.
Do you have any guidelines for when it's appropriate to, if a patient? Well, I work with Alzheimer's patients a lot, so when it's appropriate to redirect them and say, if they're looking for their husband and their husband is dead, to say, no, you live here now, Or is it okay to say, yeah, your husband's down the hall, so they don't get all upset? Do you have any guidelines like on, or if somebody's repeating themselves, say, yeah, we already talked about that, do you remember? Or just to keep acting like they didn't repeat themselves?
It's a great question, and I'll try to repeat that. The question is, what's the best way to deal with somebody who is because of their dementia, because of their Alzheimer's disease and their memory problems, is living sort of in the past, or like for instance, maybe thinks that their husband is still alive and talks about wanting to go see their husband, and although he's been dead for 20 years or something. That's extremely common as well. And as you can imagine, I mean, you know why that is. It's part of the illness. I guess there's no absolute right and wrong to that. I've seen folks do it either way, and I think a lot of folks just have an ethical problem with. They feel like they're lying, if they go along with the person, and they say, well, I missed, your husband is just down the hall or whatever. I would say that it's okay to try to reorient to the future, and but if it comes to I don't know that I'd say, well, your husband's been dead for 20 years, because unfortunately then they may go into a grief mode. And that's tough, because they'll go into grief mode every time you do that, because they don't have their short-term memory is gone, so they can't lay down a new memory. So if you tell them that their husband's been dead for 15 years now, 4 hours from now, they won't remember that. So what ends up happening usually, just because folks they can't reorient over and over again because of the grief process that goes on, is that usually the staff just allows the person to believe that, and just changes the subject, or talks about the husband, and says, well, tell me about him, and just distracts the person. That's probably the best thing that I've done, is just when I deal with someone, is I'll distract them a little bit. I'll talk about the person, or I had a woman who I'd come in and see her sometimes, and she'd talk about her husband and how mad she was at him, and she wanted to punch him right in the lip, and of course he'd been dead for 15 years, but she kept saying he just had been there visiting, and all that. And so I would just talk to her about it, and boy, that must make you pretty upset. You don't have to necessarily lie, but you just you meet them where they are, I guess is the way I think about it. And I think that's okay to do that.
In the early stages, is it ever beneficial to say, you already told me that, or or is it usually just cause more stress on them?
It might cause more stress on them. I mean, I think that's hard on the caregivers, because they hear the same story over and over again. The question was, how do you, in the early stages, do you redirect the person every time they say something that's inaccurate, or if they tell you a story they just told you, an hour ago, do you say, well, you just told me that an hour ago? And the problem with that is, it's sort of, in the early stages, it reminds the person that they're having difficulty with their memory, and it could be another thing that causes them a lot of grief. So I don't know how it would hurt to just go along with it, really. I mean, if they're asking the question over and over again, then sometimes you have to distract or change the subject or something like that, because you'll just get burned out by hearing the same thing over and over again. But it's a challenge. If you're taking care of somebody who has Alzheimer's and you have some experience with that, you guys know what I'm talking about. It's the caregiver burnout is a major issue. So it's not a sign of weakness. I think a lot of family members think that if they love their spouse or their family member enough, then they should be able to do this. I don't know too many people that can do it, where there's one person that can do it 24/7 and not get burned out. It's a pretty tough thing to do. Other questions? Okay, do you want to hear about potential side effects or anything on the medicines, or do you have questions about that stuff? The Aricept and the Namenda and those drugs, they're fairly safe medications. Remember I told you the Aricept increases this chemical. It does that in the rest of the body too. So in the gut, it does that, and it can cause some diarrhea or some nausea. Also can cause the folks to lose their appetite. So sometimes you'll have to watch that. If they start losing weight and they're kind of skinny anyway, then you got to weigh the risk and benefit of keeping them on it to slow their dementia down, or versus the risk of them losing too much weight. So those are sort of the common side effects of the Aricept medicine.